Hi, this is Jim Mazziotti of the Senior to Seniors podcast, where I dive into the stories of seniors, explore their unique experiences, discuss the real issues facing seniors today, and introduce you to those assisting seniors in their senior journey. I have the privilege to talk with some of the most interesting people in the world and in the senior community. Today, my podcast is, I would say, a little bit different than all of my other podcasts I've ever done. You see, I recorded a podcast with a Dr. Marianne Pinkston. You can see her in my senior to seniors background. And the slide that I was planning on using to actually advertise the podcast. However, when I recorded the podcast last week with Dr. Marianne Pinkston, and one of the best podcasts I think that I've ever done, and having one of the best guests that I've ever had, I failed to hit the record button, or I erased it, or I did something I've never done before. I reached out to Dr. Pinkston by email yesterday when I was trying to upload the to get it on the internet to tell her that I made some grave error and that the podcast didn't record, and to apologize to her and ask her if she might be interested in coming back. But she's so busy. She's such a busy woman. Finding an hour to spend with me is probably very difficult. And I was very appreciative that she did in the first place. I feel so guilty that I messed up the recording and even asking her to come back. So here's what I want to do today. What she has to say is very, very valuable to seniors. You need to hear Dr. Marianne Pinkston, MD. You need to hear her message. And she has numerous YouTube videos and places where you can find her on the internet. Please do that. Please reach out and find a show that she's done, because she has covered virtually anything that you can imagine in the healthcare industry. She is uh, an honest woman who knows so much and has been there and done that. So I'm going to share with you today a YouTube video that she did, so you can experience Marianne and then decide, is she someone I need to connect with? I think she is, at least in watching Better Life TV that she's on, or sharing and watching her YouTube videos. So I'm going to share with you one on osteoporosis that I found particularly interesting. And as a matter of fact, we didn't even get into when we spent 50 minutes together last week, because there's so much she could talk about. This is really important. So I'm going to share with you the 27-minute YouTube video that she did on osteoporosis, because it affects both men and women. Something that I didn't realize really affected so many people. As a matter of fact, she'll tell you, she'll point out in her YouTube video that osteoporosis actually kills more people overall than cancer and heart disease do both together. I think that's important for you to know. And so I want to share that with you. First, I want to give Dr. Marianne Pinkston the kind of introduction that I gave her when I was with her on the other recording, so you know something about her. Dr. Marianne Pinkston is a graduate of the University of Texas Health Science Center in San Antonio and of Christus Santa Rosa Family Practice Residency Program. Graduating in 1997 and starting her clinical solo practice in 2000 with her husband, she provided South Texas with the best general care in family practice until 2007, when she developed rheumatoid arthritis and where Dr. Pinkston then began her journey into integrative and functional medicine. She earned tens of thousands of hours in training and degrees in stem cell and peptide certification, as well as anti-aging, natural hormone replacement, weight loss, regenerative medicine, and integrative medicine studies. Dr. Pinkston is a specialist in weight loss, having gained up to 300 pounds at one time and developed diabetes and high blood pressure. However, she lost 162 pounds in a year and 2 months, regaining her precious health and soon training to a high athletic level. Dr. Pinkston also provides natural hormone replacement therapy for men and women and treats autoimmune I can't even say it. Autoimmune, good grief, autoimmune conditions such as metabolic, thyroid, gut health, exposure medicine, and many other inflammatory diseases. Autoimmune. I can't even believe that I can't say the word once in a while. However, look past me, look past dumb old me, and give this a listen. I'm going to try to share that right now, and I'll just sit back for the 27 minutes while you watch and take part in what she has to say because I think it's so good. So listen, you enjoy the 27 minutes, and I'll be back with you as soon as she's done.
Welcome to The Better Life with Dr. Marianne Pinkston. Join Dr. Pinkston today. She teaches you how an integrative approach to health, combining holistic and contemporary medical information, can lead you to the better life. And now, here's your host, Dr. Marianne Pinkston.
Hey, everybody. Welcome into The Better Life with Dr. Pinkston. I am Dr. Marianne Pinkston, and always bringing you some health tips and health information, hoping to keep things on the more holistic, kind of natural side, but love to combine it with contemporary medicine and bring you the best science that is coming up lately. And today I am alone at the mic again. I want to bring you guys some information that typically people will think of as a female or a woman's disease, but it actually is occurring more and more in men. So this is very important for all of you out there. And today I'm going to talk about osteoporosis. So what is osteoporosis? I mean, you've heard the word. You think about osteoarthritis. You know, people always know what that is, but what is osteoporosis? So osteoporosis is thinning of the bones. And this thinning of the bones occurs over, most of the time, over decades. And about our 60s, 70s, 80s, especially when women go through menopause and lose their estrogen, their bone loss becomes exponential. And so people who get into their late years can be very spry and healthy, seemingly doing very well. Your doctor's not ordering your bone density scan or your DEXA scan, and all of a sudden you just take a little trip and a fall. As we get older, we don't walk as well. Even me now, I can't catch myself quite as well as I used to. Just an outstretched hand or a hit on the head or sit down really hard even, and a bone breaks. Normally, your bones can take you, doing an enormous amount of stepping, falling, working, jumping. And as we get older and those bones get thin, that ceases to be, your bones cease to be very strong underneath. And it's not something you feel. It's not something you know is happening. You just have to go to your doctor and be checked for it. And the bone density or the DEXA scan is the best way to do it. It's a very simple x-ray. And then they do some mathematical calculations and they come up with a number. And that number is what the doctor will look at to decide where you are in the stages of bone thinning. So there's a point where you transition into something called osteopenia, which is thin, but not all the way thin, I guess, not pathologically thin. But even at osteopenia, you have a 65% chance of fracturing a bone if you fall or hit yourself hard. And osteoporosis is an 85% chance. So we have to take osteopenia just as seriously as we do osteoporosis. So what happens is, you can break a wrist or a finger or a foot or toe, and generally that's okay. That doesn't really disable you. But what does become disabling, and what I want people to understand why this is so important, is because if you combine heart attacks, strokes, and cancer together as far as deaths go, there are actually as many, if not more, deaths that occur from osteoporosis. And most people do not hear about that. It's not, big in the media. We don't have Osteoporosis Month, the Awareness Day. This is something very important. So what happens is we have the little vertebral bones in our back, those little square bones that look like they're stacked on top of each other that make up your backbone, or you have your hips. Those are the two areas that if they fracture, actually can cause significant disability. It's significantly painful. So those bones in the back, especially, what they do is they kind of collapse on themselves. If you take a water bottle or a Coke can and you smash it, that's what it looks like when that bone collapses. Exceedingly painful. When things are that painful, people have to go into the hospital and have procedures and surgery. They have to, take most of the time narcotic medications because it's absolutely so painful. So you've got people already on a lot of medications and also also debilitated enough where they can fall very easily. They get confused very easily. And then if you break a hip, you have to go through, get surgery. Most people wind up having to go to a nursing home. So you can be very active and spry and, not very ill and traveling and doing all these wonderful things. You break a bone in your back or in your hip, that could be the end of you. It's very serious and it's very painful, and it does end lives. So what do we do about it? How do we prevent it? Women need to, and both women and men need to concentrate on weight-bearing exercise. So walking, even weightlifting when you're standing up, squats and things like that. Things like a recumbent bike is not as good as actually being up on your feet. So weight-bearing exercise. Making sure that you take plenty of vitamin D. And I always explain to people you need to take vitamin D3 with K2. K2 is not in our food and it's no longer in our soil. It's not something that we make in our body, but it's very necessary to help your vitamin D work better to shovel calcium into your bones and build bone. So vitamin D, I would take at least 5,000 units a day. Almost every single person I test in my clinic, and I test very aggressively for vitamin D, starting in your early years, like your childhood. Almost every single person I've ever tested are extremely low in like 6, 12, 20, and you should be somewhere between 60 and 80. So keeping your vitamin D is very, very important from your very, very early years. So guys, make sure you get your children and your grandchildren with vitamin D. The other thing is making sure that your hormonal levels are normal. So in our late 20s, we begin to lose our hormone levels. Women continue to make estrogen until they go through menopause, and that could be very early menopause or surgical menopause when they have their ovaries and their uterus removed, or it could be all the way to mid-50s. So the average age of menopause is 52, actually. So whenever, menopause occurs, women lose their estrogen, and that's when it becomes critical to women and bone loss becomes exponential. The other thing is then testosterone. So testosterone begins to disappear in men and women in your late 20s. So as you start to lose your testosterone, you lose 10% of your muscle mass every decade. And you also lose a significant percentage of bone mass, not as much as muscle, but it does begin to disappear. Diabetes and smoking and poor nutrition are all risk factors for losing bone more quickly. So you have to watch your disease front and make sure you're taking care of yourself. Having taken a lot of the PPIs or the anti-reflux medications for acid reflux, Those medications also prevent you from absorbing your calcium and your vitamin D and other vitamins that are crucial to building up your bone mass. So you can see there's a lot of different risk factors there and a lot to think about. And I want you guys to keep some of these things in mind. So let's say you've got mom or grandma and you're curious about, their bone density. You get it done. They have osteoporosis, or you have a male who is, in his later years, lost his testosterone and diabetic and smoked. So you take them in, get them a bone density. It's very easy. A doctor does have to order it. You just go to a radiology suite and that you lay on a table like a simple x-ray. Like I say, it takes just a few minutes. Most insurances will cover it. And then you get your result with your doctor. Then most doctors will spend about 5 or 10 minutes with you and say, here, take this medication. So, of course, medications we always try to avoid as much as possible. You realize that being preventative is a lot easier and better than waiting until it occurs and then trying to fight to get back. When we try to treat osteoporosis, there are a lot of different ways of doing it, but none of them are as good as just preventing it from occurring. So most doctors and most insurances, so here's another little pet peeve of mine, insurances definitely push doctors to choose and select certain medications to start out with at least. And these medications in my mind are not very good. They actually can harm you down the road as much as help. So when you get this bone density, what is the bone density reading? The bone density is reading mostly the outside casing of your bone. So when you think about a steak, when a butcher cuts a steak and they have the little bone in and you remove that bone, you've got that ring of white around, and then you've got that lacy network that is inside of the bone called the bone marrow. The inside, the marrow, is the most important part of the bone. If you think about a straw, if you try to bend a straw, it's usually very hard, but once you get it bent, it snaps and it bends really quickly and very, very easily once you get it to that point, critical point. So your bone is just like that. And if you put cotton inside of that straw, it's not going to bend and break quite so easily. So that's what we want to do, is build up that bone marrow. But the bone density test tests the outside of the bone. And that seems, everybody would think that's the best part of the bone, but it's actually not. So there are certain medications that will help to, improve bone density. So even if you build the inside of the bone, the marrow, and with medication or hormones that help to build the inside, the bone density may not pick up that you're getting improvement in your bone density. It's just testing the outside of it. So I focus on making sure we use medications and hormones and things to help build that inner part, but bone densities don't always improve. I'll share a quick story with you that I had osteoporosis at one point. Actually, I was very, very at the end of osteopenia, just about to cross over. With my rheumatoid arthritis, I'm only 53, but with my rheumatoid arthritis, I took a ton of steroids trying to get control of my disease and ease my pain, and wound up thinning out my bones. So I'll explain to you in a minute how I got rid of it, because within a couple of years, I actually cured my condition with my doctor. But what we try to do is build up that bone marrow. One of the medications that's often used, like I say, that insurances push doctors into using, are the things like Fosamax, Boniva. There's a couple of other ones. These are the medications that you have to sit upright and swallow a pill. You have to stay upright for at least 45 minutes to an hour. You can get a lot of acid reflux. Not a big deal if you don't have that big of a problem, but that taken once a week, most doctors will leave you on it for years and not realize that you only have to treat for 3 or 4 years. But Fosamax only builds the outer casing of the bone. It does not work on the bone marrow. In fact, it turns off the cells that allow you to build your bone. So I usually won't use things like Fosamax because of the side effect potential, but also because it doesn't build the right part of the bone. The other thing that can happen too, after taking it for so many years, you can actually increase your risk of having a thigh fracture or have an osteonecrosis of the bone in your jaw, which means it just deteriorates and dies, and that becomes a very serious condition as well. So those are the things that are elevated as you take this medication, not very convenient. There are other other medications that you can do that do help to build bone. Don't always turn off your bone making cells. You can go for an IV twice a year. There are other shots that you can take and whatnot, but most of these things really, again, don't hit the inner making of the bone. So one of the things that you can use if you have osteopenia and kind of middle age and up to about 60 or so, I use something called a Vista or raloxifene. This is a tablet you take once a day. You don't have to modify sitting up or how you take it. Doesn't hurt you. And mostly it can have some other great effects. There are some breast cancers it prevents, and it helps cholesterol in women. And it's called a SERM, a selective estrogen reuptake modulator. Excuse me. I'm thinking about SSRIs for antidepressants. But the SERMs actually do help to build the middle of the bone. It's a little bit slow, but that is an option. And insurances do cover it. Just most doctors really don't think about it. What I really do and what my favorite thing is to work on your hormones, your natural hormones. So if you think about it, when you're 20 and your hormones are, quote, normal, unquote, then you really don't have things like osteoporosis, heart attacks, cancers, things like that. It's as we age and lose our hormones that all of these things appear. So I like to replace your hormones and do bioidentical hormone therapy and use something that is natural to your body. It is something that is the same chemical structure as what your body used to make, and we are just replacing. It's very mathematical. We don't take you to these super duper levels and try to make you the Incredible Hulk or turn women into men or anything like that. I use in women estrogen and testosterone, and I give progesterone as well. Estrogen, this is basic, but estrogen builds bone. Progesterone pretty well keeps it stable, and testosterone keeps it stronger and helps build. In men, they do need estrogen. So when they do testosterone, a lot of men choose to do the injectable testosterone. That is synthetic, and it will increase your estrogen levels too far. So you can have the shrinking of their testicles and kind of the man boob syndrome. You can also have a lot of agitation and irritation. That is where roid rage or steroid rage comes from. It comes from estrogen levels being too high, not from testosterone. And it can increase your red blood cells. So there are a lot of things that I don't like about the synthetics. So I like to use, again, the bioidentical and natural because it does not do that. And when your estrogen is too high with synthetic testosterone, we have to give you an estrogen blocker, and that's not good. It can affect your bone health and your cancer risks and heart disease risks down the line. So I don't like to do the synthetics. I do use a natural. So these are some of the things that I like to work with, and I'm going to explain a little bit more about it, but we are coming up on break time, and I do need to say a few nice things about some people who have really supported me this year, and I do appreciate it. Going to say goodbye to Pinnacle Clinical Research. They have been a great sponsor this year, and I absolutely appreciate all the docs and everybody who have come to help me with that. And so one last time, I'll tell you, I want you to go get your liver scan because 1 in 3 people in South Texas have fatty liver and don't realize it. And you can go for a very easy, painless, free fiber scan. Takes just a few minutes. So I'll have you go to pinnacleresearch.com and you can put in for your appointment right there. Get yourself scheduled. Go get it done. Very, very easy. You can also call 210-529-7978. The other people who are new to the scene here with me are Harbor Hospice. So Harbor has been working with me and my patients for a few years now. And Anna and Greg over there have been fantastic to me. So I want you to understand, and we're going to have some interesting shows coming up about hospice. That is something that people have intense stigma and myths about. We're going to level a few of those, but they do have the highest level of health care that occurs in the home. And you can go to harborhospice.org, but it is spelled HARBOUR hospice.org. You can go to drpbetterlife.com. You can find all of my information, all my sponsor information. You can also find the links to YouTube and all of the podcast platforms, iTunes, Spotify, whatever platform that you use, drpbetterlife.com. Find out more about me and the shows, my blog, all of my sponsors, and all of my previous guests. So please take a look, and we are going to take a short break. Come back on the other side, talk a little bit more about osteoporosis.
Fatty liver is linked to two different situations, alcohol and diabetes or obesity. In both cases, patients can have no symptoms. In the United States, and in particular, Texas, the most common cause of liver disease in general is non-alcoholic fatty liver. Again, associated with overweight, obesity, and or diabetes. Additional risk factors include high cholesterol, high blood pressure, Hispanic ethnicity, and postmenopausal status. At Pinnacle Clinical Research, we offer a quick, non-invasive ultrasound-based screening assessment called FibroScan. This test is done at no cost to you, and we do not take insurance. The test will measure the fat and stiffness in your liver and stage your risk and development of fatty liver disease. You will meet with a provider immediately following your scan to go over your results. If you're interested in getting more information on your liver health, please call 210-982-0320 and schedule your FibroScan today. We are conveniently located in the Medical Center at 5109 Medical Drive.
Welcome back. We are talking about osteoporosis today. And men, this is just as important for you as it is for women. And so what I was talking about before the break is about different ways of treating osteoporosis. I gave you a little bit of information on how hormones are used and what type we use, but what do they do? So the hormones actually rebuild the bone from the outside and the inside. It also helps to strengthen them and keep them stable. And this is one of the most natural and easiest things to do. And with hormone therapy, you get a lot of other benefits, as you know, such as lowering your heart attack and cancer risk, lowering your osteoporosis risk, of course, what we're talking about, but your Alzheimer's risk as well. Studies have shown since the 1930s that bioidentical natural hormone replacement is exceedingly safe and exceedingly effective. So I like to drive people into the more natural. And what I do on top of that, usually, it depends on how severe your osteoporosis is. If you're past osteopenia and into osteoporosis, then doing the hormone replacements is very, very helpful. But I also add on another medication that has been around for many years now, since I started practice almost 20 years ago. Something like Forteo or Tymlos, there's two of them now. But this is an incredibly effective way of building bone, and it rides on a natural factor. So it is still a medication, a pharmaceutical, but it does go to the body and go directly to bone to build it. What it is an injection, so don't be afraid. It's in an easy little pen with the tiniest little needle, like a mosquito bite. It doesn't hurt. It's made for people with arthritis of the hands, and so it's very, very easy to use. And it is a daily injection that you can use for up to 2 years. You may not need to use it that long, but once you're done, you're done. And it's basically parathyroid hormone. So our bodies make parathyroid hormone. We have little glands that sit in our thyroid gland, and they make PTH, or parathyroid, and that is what builds our bone. Like everything else, we begin to lose that over the years. So when we give these injections, we boost those levels. So we're using basically 2 to 4 hormones that are natural to our bodies to help rebuild our bone, rebuild from the inside, rebuild from the outside, and ultimately is not only effective, but permanent. So in my mind, this is the best way to do it. And again, you add on the other factors such as your less fatigue, you have more energy, better muscle build, which helps to slow down aging, it helps to slow weight gain or even help with weight loss when you build your muscle, build your energy up, you can exercise again, then you can get your weight-bearing exercise in, which also helps to build bones, stay on your vitamin D with K2, D3 and K2, And that is the ultimate edge right there. The benefits are too for women, an increase in your sex drive. For men, again, the energy to push through and, be with your family and do things after you get home from work. Same with women. So these are all the better ways I feel of building bone, and almost everybody can do it. Even women who have had breast cancer or anybody that have had blood clots can still do hormone therapy. After a certain period of time, when you are clear from anything reoccurring, you can do it. So I would love to let you guys know these are the things that I do with my patients and is available to you. And you can visit my clinic. I am here in San Antonio. I see people telemedicine as well. All you have to do is call 210-698-7825. And I'm basically at Shanefield in 1604, which is out in the Helotes area. And it's a quick drive if you can avoid the peak times of traffic. But come and see me. And you can go to my website at PinkstonFamilyPracticeSA.com. SA is in San Antonio. But you can also look through all of my interesting guests that I've had on my show. You can find the links to my show for YouTube and all of the podcast platforms. I've got over 80 shows now, a year and a half that I have worked very hard. Lots of fantastic guests, lots of great things that I've talked about by myself, things that you should be interested in for all ages, men and women. And go to drpbetterlife.com. You can find all of the links there. And so, in looking at osteoporosis, I definitely want people to pay attention to this. Go ask your doctor for a DEXA scan or a bone density so that you can build your bone back and extend your life. Many people can live a long, great life, but when something like this happens, it's devastating. And maybe if you don't want so much quantity of your life, we definitely want quality. And to end your life for, weeks and months or years of pain and, stuck to narcotic medications and, devastatingly losing your mom or dad or, losing your own life to osteoporosis is something that is absolutely, completely preventable. And so many people these days have osteoporosis more than ever. I'm finding men, women, and children in their teens and 20s and 30s already with low testosterone, already with low vitamin D, gaining weight, not eating, not exercising, not eating well, not exercising. And these are the things that ultimately will take your life later on. So as we come to an end, I want to wish everybody a happy holidays. And again, please visit drpbetterlife.com for all of the information on me and my show. And again, happy holidays. And thank you guys very, very much.
So I think as the music fades out, that you have to agree that her show is very interesting and full of facts. I'm a realtor, but the reason I have gotten into the senior business is because I'm a senior myself, and senior issues are real. Things like osteoporosis can cause so much harm that will chase people out of their homes, will put them in a place where they don't want to be. And so hopefully you found this show of value. And I want to thank Dr. Pinkston for spending time with me before, and I hope this is beneficial to you. And I'm hoping that she'll allow me to interview her again. Reach out to her, Dr. Marianne Pinkston, MD, in San Antonio, Texas. And I hope you enjoyed this podcast. A little bit different, but I hope you enjoyed it. Thanks for joining me. Have a great day.